There's three basic types of incisions for breast augmentation. You can go in the axilla or the armpit area, go around the areola, or in the fold underneath. I think there's benefits and drawbacks to each one, and I usually perform all three. So the armpit incision or the axillary incision has the benefit of not having an incision on the breast. The downside of that is if you're in a bathing suit or in a bikini and you're at the pool and you raise your arms up, you're going to see that incision, whereas the other two, you're not. The real benefit of that incision is that you're not really touching breast tissue. You're going in through the armpit, you're going directly underneath the muscle, so there's less changes on the breast in mammography or radiographic imaging. The periareolar incision, I think there is a smooth transition between the change in color between the breast and the areola tissue itself, so it kind of tricks the mind a little bit, and I think that incision actually heals in with the least visibility. The risk of nipple sensitivity or breast sensitivity is not increased based on the incision location. It's actually the size of the implant. So the bigger you go with the implant, the more that risk is. The risk of infection is slightly higher, which can lead to capsular contractures down the road. The inframammary incision, if you're sitting upright or standing upright, the breasts hang over top of that incision, so it makes it much less visible. If you're lying down, then the breast tissue moves and it becomes a little bit more visible. So it does tend to be fairly well hidden and heal well as time goes on. The studies have shown slightly increased chance of loss of sensation in the inferior portion of the breast or the bottom of the breast, more so than the other incisions, but infection rates are lower than around the areola. So I use all three. I think depending on the patient's anatomy and what they're trying to achieve and what their concerns are, I will use whichever incision I feel works the best for them. For instance, if one nipple is lower than the other, you can use the superior portion of the areola incision to remove a little tissue and raise one side up to try and get a little bit more symmetry out of it. But really it's I leave it up to the patient.